Hello again. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Here I am again with a summary of the Editor's Choice and Highlights articles in the February 2016 issue of Mayo Clinic Proceedings. You can access these articles on our website for free, at least during the month of February, and some of them actually for 60 days. It depends a bit on the type of article. Our editor's choice this month is the original article, High Exercise Capacity Attenuates the Risk of Early Mortality After First Myocardial Infarction, the Henry Ford Exercise Testing Project, that was written by Gabriel Shea from the University of Miami Miller School of Medicine and colleagues from several U.S. healthcare institutions. They examined the influence of objectively measured exercise capacity on early mortality after a first myocardial infarction in a retrospective cohort study that included over 2,000 patients. These were patients who underwent clinical treadmill stress testing at some point in their lives and had a first myocardial infarction during follow-up. In this study, higher baseline exercise capacity was independently associated with lower risk of early death following a first myocardial infarction. One of our highlights this month is the review article, Focused Cardiovascular Care for Women, the Need and Role in Clinical Practice, that was written by Dr. Mariana Garcia from Mayo Clinic in Rochester and colleagues from several U.S. healthcare institutions. In this review, the authors provide an overview of the current understanding of the cardiovascular physiology and pathophysiology across women's lifespan and specifically discuss types of cardiovascular disease that are only or more commonly seen in women. The authors emphasize the importance of integrated, multidisciplinary programs in women's heart health and disease. Another chosen highlights in this month's issue is the review article, Advanced Innovations for Pain, which is part of our ongoing Symposium on Pain Medicine. This article was written by Dr. Tim Lamer from Mayo Clinic in Rochester and colleagues from other U.S. healthcare institutions. The authors discuss in detail spinal cord stimulation and intrathecal drug delivery system therapy for patients with intractable pain that have failed reasonable attempts at conservative pain care measures. You can get up to 1 hour of CME credit for reading this symposium article if you complete the appropriate documentation. And third, but certainly not last, among this month's chosen highlights is the original article, Heavy Testosterone Use Among Bodybuilders, an Uncommon Cohort of Illicit Substance Users, that was written by Dr. Mary Westerman and colleagues from Mayo Clinic in Rochester. The authors posted an anonymous, self-administered questionnaire on message boards of internet websites that are popular among anabolic androgenic steroid users. They received over 230 eligible responses. Among the many interesting findings in this report are the facts that contemporary users of anabolic androgenic steroids represent an educated, employed, married, and higher earning group that undergoes routine physician and laboratory monitoring, but the majority of which have side effects both on and off testosterone. You can find these and many other free articles on our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, and please also take a moment to connect with us on Facebook, Twitter, and YouTube so we can keep you up to date on what's happening at Proceedings between our monthly issues. And it won't be long at all until I get to share the highlights of the March 2016 issue of Mayo Clinic Proceedings with you. Until then.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.